Your doctor told you that everything looks normal, but you are exhausted. Your joints are aching without any reason. Your hair is falling out. Your brain is foggy. And your hands, they change colors in the cold. What if I told you that these are the signs of your immune system quietly attacking your own body for months or even for years? I'm Dr. Diana Girnita, a board-certified rheumatologist, and in this video, I will teach you 5 specific signs that make me think about autoimmune diseases even before I order any blood test to confirm it. So stay with me because this video could save you many years of suffering and could avoid seeing 10 specialists before you are sent to see a rheumatologist. Sign number 1, fatigue that sleep doesn't fix. Now let's start with the most dismissed symptom in all medicine, fatigue. Yes, this is not regular tiredness, not that kind of tiredness that a good night's sleep will fix. I mean, waking up after 8 hours of sleeping and you still feel like you have never slept. Hitting 2 p.m. in the afternoon and feeling like you are exhausted. You cannot go on. Feeling exhausted in a way that your workup, your sleep, and your stress level cannot explain. This is inflammatory fatigue. It is driven by cytokines, which are inflammatory proteins of your immune system that are released when the immune system is activated. They signal to your brain to conserve energy because your body thinks it is in a constant fight, something serious. Even when there is no infection, even when every lab work comes back normal. And every week in my clinic, I hear the same thing. I used to be a person who did everything, and now I can barely get out of the bed or I can barely go through my day. But their doctors told them that they are fine. Now, here it is what makes this fatigue clinically meaningful. This fatigue is persistent for weeks and for months, not only for days. It comes with brain fog, which means that you have trouble concentrating, finding words, or thinking clearly. And it is almost always showing up along with other 1 or 2 of the other signs that I will put on this list that we will discuss today. Sign number 2 is happening in your joints. And most people are living with it for years without realizing what exactly it means. Morning stiffness that lasts over an hour. Quick question, when do your joints hurt most? In the morning or later in the day? Because the timing is one of the most powerful diagnostic clues in rheumatology. It will separate inflammatory arthritis from the regular wear and tear almost immediately. Now let me explain to you. With osteoarthritis, which is the wear and tear, pain gets worse through the day with repetitive use. And it is better in the morning and it is better after resting through the night. Now with inflammatory arthritis, like in rheumatoid arthritis or psoriatic arthritis, it's the complete opposite. It is worse in the morning and it will last over an hour. And it actually is going to improve as you move, and your joints will warm up. That is why I ask every patient, do you need a hot shower before your hands work properly? Do your ring feel tight when you first wake up in the morning? Does it take you over an hour before you feel like yourself again? Because this is not aging. This is inflammation. In rheumatoid arthritis, the base knuckles and the middle finger joints are affected on both hands at the same time. And that symmetric pattern is also a red flag. In psoriatic arthritis, one finger can swell up like a sausage overnight. And this is what we call dactylitis, which is one of the most specific signs that I know for psoriatic arthritis. Now, joint damage from inflammatory arthritis is not reversible. But if we catch it early, we can stop it from happening. This was sign number 2. Now, sign number 3 shows up somewhere most patients never think to look, and it is the most visible, most under-recognized clue of all autoimmune diseases. Sign number 3, skin and hair changes that you keep dismissing. Your skin is the largest organ of your body, and it is often the first place your immune system will leave a visible clue. A butterfly-shaped rash across the cheeks or the nose, which is worse in the sunlight, is one of the most recognized signs of lupus. But not everyone with lupus develops it. When I see it, it immediately redirects my entire evaluation. Now, skin that feels tight, puffy, or harder to move, especially on the fingers, on the hands, or around the mouth. This can signal scleroderma, where the immune system attacks the connective tissue. Then, psoriasis. Have you seen people with red, scaly patches over the elbows, knees, or in the scalp? This affects about 3% of the population, and 25 to 30% of people with skin psoriasis will finally develop psoriatic arthritis, which is a very common misdiagnosed form of arthritis. So if you have psoriasis and joint pain, you need a rheumatologist, not just a dermatologist. Now let's talk about a sensitive topic, hair loss. Diffuse shedding all over the scalp, not just in one spot. It's a common complaint in lupus and autoimmune diseases, usually thyroid diseases, and it gets dismissed as stress almost every time. Sometimes it is stress, but alongside with fatigue and joint pain, this is actually your immune system attacking. Now let's move on to the next sign. This next one is one of the most people blame on aging, on screen time, or allergies, but it is actually one of the most specific clues pointing a disease that affects 4 million Americans, and it is almost never caught early. Sign number 4, dry eyes and dry mouth that never goes away. How long have you been using eye drops? Do you wake up at night because you need to drink water? Do you sleep with a glass next to your bed every single night? I ask these questions to all my patients that come to be evaluated. Why? Because dry eyes and dry mouth, when they are persistent, when they do not respond to over-the-counter remedies, and when they appear together, they can be a hallmark of another autoimmune disease called Sjogren's disease. Now, Sjogren's is the second most common autoimmune disease in rheumatology after rheumatoid arthritis, and many times diagnosed very late or misdiagnosed, or it is completely dismissed. However, it will affect about 4 million Americans. And the average time from the first symptoms of diagnosis is nearly 7 years, because patients, first they see an eye doctor for dry eyes, then they see a dentist for the dry mouth, then a gynecologist for vaginal dryness, and nobody will connect the dots, but they are actually the same disease. Beyond dryness, Sjogren's disease can cause significant fatigue, joint pain, brain fog, and in some patients, it may attack the lungs, the kidneys, and the nervous system. The antibodies to look for Sjogren's are anti-SSA and anti-SSB, but up to 25% of Sjogren's patients are antibody negative, which is exactly why you need a rheumatologist, not just a blood test. Dry eyes, dry mouth, plus fatigue, plus joint pain, it's not aging. It is actually a pattern, and it will deserve to be evaluated. Now let's move on to the last sign. The fifth sign is one that patients will find strangest because when it happens, it's almost alarming. But it is actually one of the most common and most specific early signs that I know in rheumatology. Sign number 5, Raynaud's. It's when your fingers change color. Has anyone have ever looked at your hands and asked you, are you okay? Because your fingers are turning white or then are turning blue. That is Raynaud's phenomenon, and it is one of the most specific early warning signs of connective tissue disease. Now here it is what is happening. Cold temperature or emotional stress will cause the small blood vessels in your fingers to constrict. And then, because of the blood flow is cut off, then the fingers will turn white. Very slowly after that, the fingers will start turning blue. But when the blood flow returns, it flashes red. And this Raynaud phenomenon sometimes is painful and tingly, and it can be something that happens on its own, which we call primary Raynaud's, and that is usually benign. But the Raynaud's, along with fatigue, with joint pain, with dry eyes, with skin changes, it's called secondary Raynaud's. And that can be an early signs of rheumatoid arthritis, of lupus, scleroderma, Sjogren's, or mixed connective tissue disease. And that's why you need a rheumatologist to look further, especially in scleroderma. Raynaud's phenomenon often appears many years before any other symptoms. And that's why when you see changes in your colors of your fingers, this is something that does not need to be dismissed. This is something to act on. Now, let me explain to you why the combination of all these signs are important. And here it is what is the most important thing that I want you to take from this video. None of these 5 signs alone makes a diagnosis. Fatigue has 100 explanations. So does joint pain. So does dry eyes. But when you have 2, 3, or 4 of them appear together, and if you are a woman between the age of 30 and 65 without any other clear cause, that is considered a pattern. And that pattern is what takes a patient from years of being dismissed to finally getting an answer. Autoimmune diseases cause damage over years, and joints can erode, organs get attacked, glands can stop functioning. And the earlier you have the diagnosis, the better you have the chance to protect the function that you have today. And that window of opportunity is real. And that's why recognizing these signs is your opportunity. And if you're recognizing 2, 3, or more of these signs in yourself, do not wait for your primary care doctor to connect the dots. Here at Rheumatologist on Call, we see patients across 20 US states through telehealth in days, not in months. No referrals, no waiting rooms. A board-certified rheumatologist will actually look at the whole picture. Now, knowing the signs is only the step 1. But you don't have to stop here. You have to learn about what are the tests that you need to confirm, what are the treatment options that exist out there, and that's why you have to continue to watch and learn from my next video where I talk about the top tests that I use to diagnose people with autoimmune diseases.